question to all panelists now. And we'll really appreciate if you can keep your answers to around 1 minute as much as possible. And okay, the question goes thus. Says, if countries want to close the innovation to implementation gap in the next 1 or 2 years, what's one policy lever or financing reform would make the biggest difference? I feel let me just reiterate on that. So if countries want to close the innovation to implementation gap in the next, let's say, 1 to 2 years, what one policy lever or financing reform would make the biggest difference? So we can have Fernando on that as the first speaker. What's your comments?
Thank you very much, and again, very good question. I think closing the gap between innovation to implementation means also closing the gap between the people who do the innovation, sorry, and the countries. So for me, one is not a policy change, but really ensuring close collaboration between the innovators. And the innovators doesn't mean necessarily a pharmaceutical company, can be organizations like my organization, public-private partnerships, and the policymakers in the country. So for me, the key is not only a change or a funding or change in policy, it's also to ensure this close collaboration to really identify the public health need and the gap. Because as I said in my previous question, every country is different. And for a specific antibiotic, every country will need to use it in specific different populations to respond to their needs. So making sure that the person who does innovation understands where is the need. And the other way around is, for me, the most important change. We haven't had any problem so far to collaborate with institutions and with ministries of health in countries, but I think that is for me key, and that also involves in a way also WHO, because is present in every country and is working hand by hand with the ministries of health. They know very well about also the prioritization processes and the tools, as Dr. Basim just explained. So I think triangulating all that could be very important. And I just to finish, say that again, because in the normal usual framework, you have a company, pharmaceutical company doing the innovation, and it's not connected with low and middle income countries. So it's people like us, like public-private partnerships, like WHO, like all these organizations that can really ensure this link. So I'm not talking about changes in policy. I'm more talking about strengthening the connection and the engagement with the partners that really decide at the end of the day and that really need the products. So I'm giving a little bit a different view, but that's my contribution.
All right. Thank you so much for those insightful words. Thank you so much. So can we hear from Rishi as well? What's your perspective on this?
Yeah, I'll keep it brief. I think yes, I agree with everything that both the other speakers have said. They're all critically important. Just in my experience, I think the key problem of financing or being able to close the gap between implementation and innovation has been the ability to communicate the problem to the Ministry of Finance or any departments which sanction and approve budgets. So communicating the problem is essential, and for that we need data, I think. So it's a slightly different take as well on your question, but I do think that when the surveillance is poor, that leads to weak cases for investment. And when there's weak cases for investment, then governments are unwilling to finance the adoption of innovation. So I do believe that stronger data sources, more robust data systems, and communicating an evidence-based problem statement to the policymaker is key to bridge that gap.
All right. Thank you so much. Thank you so much for that. All right, over to you, Dr. Basim, please.
I totally agree with Fernando and Rishi, and apology if you allow me to use your first names. But I would also like to add two other angles of the problem. Probably the first one is I think domestic mobilization of resources and financing. This is probably I think an important policy that many countries need now, particularly that we have seen shrink and shortfall in the donors' funding to antimicrobial resistance. And I think countries need to move away from reliance on unpredictable external aid, and also they need to ensure sustainable resources to scale up proven innovations. And it's not necessarily that we ask for countries to add additional domestic resources, but before doing that, maybe also several actions to maybe prioritize or make the best benefit out of the existing health budgets, right? For example, in a couple of countries like ring fencing, for example, or maybe allocating a specific budget for antimicrobial resistance has been useful, like in Thailand, for example, in many other countries. And also another way or another action is maybe strategic purchasing of antibiotics to allow their access, and also diagnostics, and also innovative approaches that working with the public-private partnership, and also working with the private sector for strategic purchasing of these tools and devices, and also instruments. And of course, the second domain, in addition to the domestic mobilization of resources, is probably also to work on the weak governance and coordination mechanisms at national level. So mobilizing domestic resources, but also improving the governance and coordination across sector and within each of the sector, because I think in many situations we see national action plans that often exist, but their implementation is probably hampered by unclear mandates or fragmented responsibilities, insufficient integration into broader health system or health sector strategies, and development strategies of the whole country. So two things have to go parallel: mobilize more resources or improve the efficiency of the existing resources, but also improving the governance and the coordination mechanism. So I think these could really, if countries work on them and improve them, this will definitely help a lot to move ahead and speed the response against antimicrobial resistance. I'll stop here. Over to you.
All right. Thank you so much, panelists, for sharing your thoughts on that. That was a great one. Thank you so much. All right. So we'd like to now open the floor for audience questions. So if you're joining through Zoom, please, you can either raise of your hand, indicate that you have a question, and I'll invite you to unmute. And okay, also you feel free to write your questions in the chat box. So we'll be able to accommodate maybe one or two questions for our panelists. So if you want to speak, you can show interest with a raise of hand, and yeah, you'll be called upon. And okay, as we await those questions, okay, let me just quickly invite each speaker, our panelists, to just share a 1 minute, very brief closing thought. So what is the key message that you would want participants here to take with them from this session? What is the key thing that you like each and every one of the participants here to take with them from this session? So we can have you, Fernando, just in a minute, as we expect some
Sure.
questions.
In 1 minute, I think for me the key is really the engagement in countries. As I said, I think we owe that to the countries. We need to really work thinking in the need, and that means that also from countries they need to ask us and to push organizations like my organization to really respond to their needs and to communicate clearly on that. So for me, it needs to be needs driven. And I mentioned implementation science because that is a specific example that is in every country may be different on how to use the drugs and how to respond to their needs. And for me, this is a key message for all the innovation. It needs to be driven by the needs in the countries.
All right. Thank you so much. Rishi, can we have you as well?
Yep, closing thought would be, see, innovation exists and there is good innovation, that very vital, critical innovation that is coming in through different sectors which can answer the AMR problem. But ultimately, it's the lesson is that, for me at least, is that innovation doesn't fail at the level of science. It very often fails at the level of systems. So if you want innovations to translate into real world impact, then we need to invest equally or prioritize equally governance, coordination, program management, human resources, long-term financing structures, and not just the technologies themselves, perhaps.
All right. Thank you so much. Dr. Bassem, over to you, sir.
Thank you, Peter. Yeah, I totally agree with Fernando and Rishi. But if you ask me for a quick key message to participants here, I think you represent the younger generation, the next and the next generation to lead on the work against antimicrobial resistance. So my message to you, colleagues, is antimicrobial resistance, unfortunately, is a transgenerational issue. It will stay with us. I hope I could have better news, but it seems it's going to continue with us for some time till countries really improve their response and also address it aggressively and also appropriately. So my message to you is, the first thing is, during your education, during your undergraduate, make sure that you learn a lot about antimicrobial resistance. And for this, WHO is going to collect some data on in the current curricula of undergraduates in the medical schools, whether it is medicine, pharmacist, vet, and other. What is the level of integration of antimicrobial resistance into the current undergraduate curricula? So we hope that we could conclude this exercise soon. The second is you need to raise your voice. You need to join the rest of the world and also push for countries and international organizations, as Fernando said, to continue their prioritization of antimicrobial resistance as a transgenerational issue. The third is related to behaviors and practices in your future areas of expertise. We expect you also to rationalize the use of antimicrobials and probably also rationalize the use of diagnostics and improve the behaviors and practices associated with all of this, whether you are a doctor, a pharmacist, a vet, or other healthcare workforce. We hope that you not repeat the mistakes that the current generation is doing by inappropriately use antimicrobials. So I stop here. Back to you, Peter.
All right. Thank you so much, panelists, for those great insight that you've shared. And I'm so confident that the participants have gotten a lot of value from all that you've shared. Now, I will just go to the chat box and probably could entertain just one question from the chat box so we can round up on this session. So this from Madhura Pade. It's saying, I think this is directed to Dr. Bassem. It's saying, sir, can you please explain more about governance role in antimicrobial resistance, as you mentioned on the last question? Can you explain more about governance role in antimicrobial resistance? Probably like 1 or 2 minutes, sir.
Yeah, thank you very much, Peter, and thanks for the question. I think it's a great question, and let me quickly try to explain. And as I said, antimicrobial resistance is a multifactorial health issue. And it happens because inappropriate use, and we have many drivers that lead to emergence and spread of antimicrobial resistance. And these drivers occurs in human health, in animal health, and even in the environment. So in many sectors. And of course, to address them, we require also finance and we require collaboration between these sectors. So lack of this coordination currently, which we call it governance, lack of appropriate or robust governance structures and multi-sector coordination for antimicrobial resistance, infection prevention, and other domains like infection prevention control, surveillance, and also stewardship is really a major problem. And that's what I meant when I say we need really to improve the governance and the coordination mechanism, not only at national level, but sometimes also at subnational level. In many countries, health is maybe a state level, like in India, for example, and many other federal states. So improving the awareness at national level, at subnational level, and also at regional, and that's what we are trying to do in Southeast Asia, the regional office, where we try to bring together all the countries and also all the non-state actors, also including private sector and also professional organizations like yours, to a platform where we could discuss and try to integrate and engage all of us into the coordination to address antimicrobial resistance, and also at the global level. And there are several mechanisms where countries, non-state actors, and also international organizations and United Nations have brought this, like what happened last year in the UNGA high-level meeting on antimicrobial resistance. So I think improving the governance at national level and subnational level could really have a huge impact in on effective strategies to address antimicrobial resistance by clear leadership, defined rules and responsibilities among stakeholders, and engaging non-state actors, including private sector and professional organizations. I hope this answered the question. Back to you, Peter.
All right. Thank you so much for that, for insight, sir. So I think we're well over time, and it's been such a great session, actually. So I want to say thank you to all the panelists that we have, and thanks to the audience too for engaging with the discussion. You know, from this session, from the discussion, you know, from length of the key barriers preventing new antimicrobials from reaching patients, you know, like including regulatory challenges, limited funding, gaps in research, to mention a few. And we also learned of the rules, you know, from the panelists, the sheds. The one thing we have to put in mind, one thing we have to, you know, keep as young people, and how we can be useful in the whole antimicrobial resistance battle. And also lens of the government's role as well, just like Dr. Basim further emphasized on just now, and also the lens of the WHO tools and so on. So it's been a very great session. And so before we close now, I'd like every one of us to turn on our cameras for a quick group photo. Then we've come to the end of the session. It's been a very great one. So very quickly, just like, you know, for a minute, can you just turn it on? I won't be the one taking the photograph, but then can we just switch on our cameras, all right, for like a few seconds. Okay, I think that should be done with now. So once again, thank you all once again. Thank you so much, panelists. And we hope you enjoy the rest of the Global Antimicrobial Resistance Youth Summit. So the session is now concluded, and I would like to give the floor to Tassavo Kahor, who will be the moderator for the next session. Thank you so much. Thank you so much.
Thank you very much.
Yes, sir.
Thank you.
Thank you, Vera.
Okay, first of all, hello everyone. I would like to request our speakers, the three speakers for the roundtable discussion, to kindly switch on their cameras so that we can interact more productively. Okay, so formally beginning the session. So hi everyone, and thank you so much for joining us today. There are more than 200 participants, and welcome to the Youth Policy Roundtable at the very last day of the Global AMR Youth Summit. My name is Tasavvar, and I will be guiding this roundtable discussion. So just to give you an introduction as to why we decided to have this session. So over the past 2 years, there have been major political milestones when it comes to AMR. So we've had the 2024 Global High Level Ministerial Conference. We've had the 2025 STAG AMR discussion, and more recently, the political declaration on AMR. And I believe each of these moments has reaffirmed the urgency of stronger governance, sustainable financing, and even coordinated action across human, animal, agricultural, and environmental health. And it's really great to see that AMR is finally getting the attention it needs. Though we're seeing it getting attention, but many of us, the youth, that's all of us in the meeting, we still feel kind of disconnected from the national structures. So the idea for this session is really simple. We're bringing together youth as well as policy voices together to unpack where those entry points actually are and what barriers we need to acknowledge and what short-term actions are realistic for young professionals and students across the One Health spectrum. And we're really fortunate to have speakers who have worked directly in either youth governance or public health leadership or global AMR policy or even all of them. And I believe they bring a lot of very different vantage points, which I hope will give us a clearer picture of both the constraints as well as the opportunities. And thank you again to everyone joining. And I'm really pleased to introduce our speakers for today's roundtable. So first off, we have Dr. Pablo Estrella Porter. He is the World Medical Association Junior Doctor Network's leader. He leads them, and he's also the chair of the quadripartite working group on youth engagement for AMR. He's originally from Ecuador. He trained as a medical doctor. He completed his master's in public health in Spain, and he's now doing his PhD in vaccine preventable diseases. And he really brings a valuable perspective on how youth can be integrated into AMR governance, both nationally as well as locally. And next, we have Professor Anthony So. He is the Distinguished Professor of the Practice and also the founding director of IDEA Initiative at the Johns Hopkins Bloomberg School of Public Health. He leads the Secretariat of the Antibiotic Resistance Coalition. His work also spans many of the global AMR processes that we refer to today, including serving as the co-convener of the UN Interagency Coordination Group on AMR, and contributing to the recommendations delivered to the UN Secretary General, and also co-authoring the UNEP's Spotlight Report on environmental dimensions of AMR. He has also helped lead global student innovation sprints such as Innovation for Health and Innovate for AMR. And he now sits on the inaugural WHO Civil Society Task Force on AMR, and so we're really honored to have your perspective in this discussion. And finally, we have Federica Castellana. She is a public health professional with extensive field and governance experience. So she currently works with the Italian Red Cross. She leads multi-sectoral programs which are focused on health equity and community resilience. Her academic background, it includes a Master's of Public Health from the University of Sheffield and an MSc in Governance and Leadership in European Public Health from Maastricht University. And she also serves as the secretary of the Young WFPHA. So I believe she brings strong experience in youth leadership and public health advocacy. And again, we're really grateful to have all three of you with us today. Thank you so much for being here. And I think we can formally begin the session. And Pablo, I'd like to bring you in first. Just a second, my internet. Okay, I'd like to bring you in first. So given your role in quadripartite working group and across the youth medical networks, you have, I think, a pretty clear view of how youth engagement actually plays out in AMR spaces. So I want to ask you three interconnected things. First, where do you see genuine opportunities for you to engage in AMR governance globally as well as nationally? Second, based on what you are observing through the quadripartite and other platforms, what does youth participation currently look like in practice? And lastly, what would it take for youth involvement to become something more stable, to become institutionalized rather than being occasional or informal? And it's over to you. The floor is yours, Pablo.
Thank you so much, Tasbur, and all the team organizing this amazing summit. It's an honor to be here. And definitely, when we talk about youth in the AMR world, I should say that we are in a really good moment because we've seen in the past few years how the meaningful engagement on AMR on youth has actually come into place. So I would say that youth engagement in AMR governments can mean three things. First, that youth are inside decision-making spaces, which can be committees, technical working groups, delegations, and not just invited to those side events or spaces. The second would be that youth shape priorities and language in the different national AMR action plans, or also on the different commitments on around AMR. So not only validating what's already been written by, for example, policymakers. And the third one would be that youth also help the monitoring process in the implementation and are part of accountability mechanisms with access to data and feedback loops, as highlighted in a toolkit that I want to share with you from the quadripartite. Then when we come to a national level pathway, I would like to also highlight that we need to push youth to have more formal representation in national AMR committees, One Health platforms, or any other technical working groups within different ministries, but not just of health, but also agriculture, environmental, or even education. So we would say that it's really key for youth to be able to identify through a stakeholder mapping and a power analysis which areas would be a space for them to access. And in a moment, I will also let you know how you can do this on the practice. Also, we need to use evidence-based advocacy. So for that, you will need to first map the national AMR context, identifying the gaps and how to bring the youth generated data and case studies into policy discussions. And on the global level, I would say that now chairing also the quadripartite working group on youth engagement for AMR has created a global platform, to systematically inform and guide also the quadripartite work and include also young people in the global AMR action. For those who are not aware of what the quadripartite working group for youth engagement on AMR is a space created by the quadripartite, which comprise WHO, FAO, WA, and UNEP. That back in 2023, in October, they created this space for youth-led or youth lead organizations to have a voice in the global space. Now we have just launched the second cohort with 14 representatives of organizations from all around the world. And having this kind of space in an international level has also allowed us to try to bring the different opportunities that are happening globally, but also bring a voice into the AMR space from youth. Of course, this is really important in one way to have these spaces, but I would say even more than just to be present, as I was saying before, is what do we do to translate this into local and national action? So now we want to align this more advocacy and also the different political windows that can happen in different regions and countries, and see how we can push for youth engagement in our governments in a more effective when aligning with different political moments. Also, it's important that youth can prepare joint youth statements, policy briefs, or other relevant documents. But for that, we want also to be, as the quadripartite working group, as a central space where youth can find also this relevant information. And for that, I want to share, actually, let me see if I can briefly share my screen. Just give me a moment. That it's the AMR toolkit for youth engagement. This is a document that was created already a few months ago, which is a great source for youth for basically do the different stages on the youth advocacy. So just to show you some examples, here you will be able to first, for the stakeholder mapping, first to understand what are the different interests of your stakeholders, but also how to frame the outputs and targets. It can be also as practical as how to write your concept note when you want to do some advocacy in the different levels, if it's national, local, as well as, for example, how to push for the resource mobilization. So in many cases, what I have seen from youth is that we have the energy, we have the motivation, but sometimes we're lacking for example, what's the messaging or how it's kind of the next steps. And I think this toolkit developed by the quadripartite could be a really great resource for youth to put in track their different initiatives and advocacy proposals. This is as practical as, for example, if you want to push for your own kind of a structure in a local or national level, either if it's with your university or with your student association. This toolkit even presents with different templates as concept notes or letters, for example, for outreaching different stakeholders. So I think this kind of resources is quite key when we talk of what we can provide as, for example, a global network to bring it from the top down. But just to conclude on how youth voices can be institutionalized in the AMR decision making, I think it's really important for us to push for more formal seats and having in the terms of reference of different structures that youth can have these formal roles with clear terms of reference on how our voices are going to be used. For example, if there's also some accountability measures that can also include the youth participation, as well as how we can include youth on the AMR policy cycle. I know that this is really hard according to which country or which regions we're talking about, but I would like probably to highlight that it's really important that youth voices are heard in the agenda setting. So, for example, youth consultations that can feed into the national AMR policies, policy formulation. So youth be co-authoring and reviewing sections on community engagement, education, and stewardship, as well as implementation and monitoring of youth networks that can co-design these different steps of the cycles. And just to end up here, I would like to highly encourage you that for sure, if you are in a weekend, in an event like this one, is because you are passionate about AMR. So what I would like is you to try to find where are the spaces where you can actively engage. It's true that sometimes when we are just starting on the AMR world or the AMR field, it might be a bit hard to move along. But I think having these kind of spaces and also the structure that we're proposing in the quadripartite, that hopefully at some point it will be more regional and at the end also more national, can also allow youth to engage more actively. And I'll stop here and give back to you the floor, Tanasur. Thank you.
Okay, thank you so much, Pablo. That was, that really set the scene on where youth can step in, what still needs attention. And I definitely agree when you said that we're very motivated, we have a lot of energy, but we don't know the messaging or we don't know how to convey it to, the stakeholders. So that's something I really agree with you on. And again, thank you so much for contributing your perspectives. And I'd now like to move on to Professor Anthony. So you have been very clearly, you've been involved in many of the major global AMR processes. So you've seen how strong political declarations, they don't always translate into real progress on the ground. So I'd like to hear your perspective on why these implementation gaps persist, even when countries, they might appear committed at global level. And building on that, what kinds of accountability mechanisms actually work in practice, and where are the pressure points that can help move countries from intention to action? And finally, since we are speaking to a youth audience today, where do you see space for young professionals and students to contribute, especially when it comes to transparency, monitoring, and civil society engagement around National AMR Action Plan? Pablo also suggested that we need to be involved in monitoring transparency. So I'd love if you could address that. And again, Anthony, over to you.
Well, thank you so much for the opportunity to join you and for organizing this wonderful platform, bringing us all together. I think my fellow panelists are actually truly more expert on how youth might engage, but perhaps I can offer a systems perspective on how we might find some points for change and leverage. We have a paradox. Since 2015, nearly every country has adopted a global commitment to actually fight AMR, but we're not implementing at the speed of resistance. Unlike COVID, which swept the world like a tsunami, drug-resistant infections are like a rising tide. And on the next slide, and the question isn't really, do we have national action plans? 176 countries have them, but only 41 countries, or fewer than a quarter, have financing in place. Only 61 countries, or a third, report even having adequate monitoring and evaluation capacity to track progress, even if they were taking action. And only just over half the countries link their national action plan on AMR with at least one other national action plan. And from whether it's water sanitation and hygiene or national food safety or agricultural development plans and policies. And this is a worrisome sign, given that AMR has few dedicated resources at the global or the national level, not like HIV/AIDS, TB, or malaria programs with infrastructure on the ground, national vaccination strategies, or environmental planning. So the question is, what will make governments actually carry them out? And that's where you come in, not just in 10 years, not after you finish your degree, but now. For those who thought that UN General Assembly's high-level political declaration on AMR adopted last September signaled commitment, just remember that apart from the aspiration of mobilizing $100 million to help national action plans globally, little funding has transpired. The AMR Multi-Partner Trust Fund that was meant to support the work of the quadripartite agencies has mobilized over the past 5 years plus $34 million or so, barely a rounding error compared to what we were compelled to spend on COVID-19. And part of the answer lies in the fact that sectors aren't talking or working in concert enough. I think you heard that on the last session about this. When there is a shortfall in global health funding, as there is now, and there has always been for AMR, the answer is not to circle the wagons around our solo cause, but to build bridges with other sectors and to help them see how our cause is also their cause, that food safety, potable water, maternal and child health, vaccinating populations all relate to AMR, which can amplify the challenges that they face. So building connection and allies across sectors is key. A second challenge is the absence of meaningful targets and financing in the high-level political declaration. The UN General Assembly instead set goals like greater than 95% participation in the TRACS survey, which is the country self-reporting survey by 2030. And guess what? They reached that goal this year in 2025. That's hardly a stretch goal. Nor is $100 million to support the work of quadripartite agencies to support sustainable financing of national action plans. Nor was the fact that most of the meaningful food system goals, to ban antibiotic use as growth promoters, prophylactic use, or to commit to actually a meaningful reduction in the quantity of antimicrobial use in food animal production, were all stripped out of the text of the UN high-level political declaration. So we will have to work to set targets, including our own. And a third challenge is that even with targets, monitoring for accountability requires making actionable data collected and available. For example, the World Organization for Animal Health still makes confidential the countries from which data are collected in its tracking of antimicrobial use in food animal production. We cannot tell at the country level which countries still use antibiotics as growth promoters. We know the data are there, but it's not made transparent to us. The rationale for actually this cloaking actually on confidentiality is that it would support or enable countries to be more willing to participate in a voluntary reporting system. But that participation, of course, does not afford accountability when we can't tell which country actually the data come from. And yet that is what countries could have committed themselves to doing collectively, make such data transparent through the UN high-level political declaration, but they did not. So next slide. So let me suggest that we take a lesson from our colleagues in civil society that have worked on food issues. One example is the chain reaction report developed by members of the Keep Antibiotics Working Coalition in the United States. They targeted the top 25 restaurant food chains in the country to source and procure food animal products and they've asked them to essentially to source them in a way that actually where the food animal products were raised responsibly without the routine use of antibiotics. And they made three simple demands. Commit not to source food animal products raised with the routine use of antibiotics, commit to a clear timeline for implementation, and commit to an independent audit for verification. And over a period of 3 years, their consumer report card prompted first 5, then 9, and then 14 of these top restaurant chains, accounting for 2/3 of all fast food industry revenue in the United States, to take steps to limit antibiotics in their supply chain. And this had ripple effects on the Tyson and Purdue's in the poultry industry, which then committed essentially to raise food animals without the use of antibiotics, notably in poultry. Now, there remains much work to be done even in this area, and the struggle goes on. But they smartly targeted those who procured these products, not government or upstream food producers directly, but public-facing brands. They set a clear target, and they made a track record of these food restaurant chains transparent against that benchmark. And that is monitoring for accountability. And we can take a page from such efforts to engage youth movements in tackling AMR at both the global and national levels. I hope that's a useful start to actually some of our discussions ahead.
Okay, thank you so much, Professor. Though I would really love if you could, address the question as to how youth can contribute to monitoring, evaluation, and other aspects of the national action plans.
Would you like me to actually show another? I have another slide I didn't actually show that could provide them actually how actually you can develop, in fact, such plans. And I was so we can pick up this actually and, for example, show how you can actually design these things. And I think the youth engagement toolkit that Pablo mentioned is a really great place also to go to. But I would apply something like the fog behavior model because what you choose depends on, of course, where you are. So you can conceptualize actually how you can affect change. The fog behavior model helps you deconstruct actually that into behavior change into three components. What's the trigger? How do you change the motivation to make the change? And how do you change the ability to make that change? And again, referring back to the chain reaction report, you can see that actually the chain reaction report is a scorecard of the top food restaurant franchises. So it both set the trigger and set a target. It also to actually change and influence the motivation for these key actors to change. It also referred to consumer surveys showing a willingness to pay, particularly by the millennial generation, for more food raised without antibiotics. And by targeting public-facing brands, food procurers that sell to these consumers this changes the motivation for that action to occur. And third, by focusing on food buyers that procure food animal products and can influence food producers upstream to make the change, they change the ability to act in the space. And those are the components in my mind if you are constructing a particular approach. It's not a matter of, what do you do necessarily? There is obviously a question of what you want to do, but the targeting also depends on where you sit. And I can get more into that actually in discussion if that would be helpful.
Okay, thank you so much, Professor. That was definitely very insightful. I actually agree when you said that we collected a lot of funds for COVID, but AMR hasn't reached even a fraction of that. And as I love to say, COVID is, it's a crisis of emergency, but AMR is a crisis of persistence. And I think that's what the national government should keep in mind. So again, thank you so much for your insights. And Federica, I would love to bring you in here. So you've spent years working with youth-led public health networks and engaging directly with policymakers. So I believe you have a really grounded sense of how those collaborations actually happen, how they actually work. So could you share what you've seen work well, especially when it comes to youth building credibility and forming ongoing relationships with policy stakeholders? Also, it would be helpful to hear a couple of examples from the Young WFPHA, whether through your regional chapters, through governance training or leadership models you have been part of. And from your experience, what lessons could AMR youth networks or AMR organizations take from the wider public health community in order to strengthen their influence on national policy process? So you can take the floor, Federica.
Thank you. Sorry, I did not, I was not finding my microphone. Thank you so much, really. Thank you, first of all, for the invitation and also for the organization of this amazing summit. And also, I think that what Professor Antoniso and what Pablo also was mentioning before is super important and linked also to the question you just asked me. I think that in the World Federation of Public Health Association and specifically in the Young Working Group, is extremely important, and I think what really the public health world and area can show is really the need of the collaboration and the multi-sectoral collaboration that AMR need, and I will start from this because in our working group, in the young working group, we have actually an AMR committee. So with different organizations, as all the structure, but then we decided to have a group that specific work on AMR. And this group is not just made of different background that of course is extremely useful, but also it really has a world wide representation. And so really help in putting together the world representation and the multi-sectoral approach that is needed in the AMR work. And one other very important aspect is that within the World Federation of Public Health Association, again, the collaboration in multi-sectoral approach comes also with all the other working group. And this is what we do. And I connected before, and I was also listening to the speaker of the previous session when they were talking about the intergenerationality that AMR has and AMR needs. And I really think that this is also one of the things that as a young professional working group, we are trying to do within the World Federation. So bringing youth voices within also the governance of the World Federation and trying to collaborate and bring in the multi-sectoral approach within all the other working groups. For example, one thing that the AMR committee has been working on, and it will be soon published, is a commentary on AMR and non-communicable disease. And so this is also to show, you know, the link with the working group, but in general, there was also link with the non-communicable disease high-level meeting of the ANGA of this year after one of AMR last year. And a lot of work also has been done with other working groups, for example, the One Health working group. So to really, as I was saying, put this intergenerational aspect and intersectoral aspect that I think is really needed in the AMR world. And I also think that what is really important and needed is the like within a structure as a World Federation, we took a decision, and just making an example. I was also talking the other day at the intergenerational dialogue organized also for the AMR week. And for the new WHO AMR task force, the civil society, as World Federation of Public Health Association, we actually decided to be represented in this task force by a youth representative, so someone from the AMR committee of the Young Professional Working Group. And so really bringing the youth voices in different international area, and for example, this AMR task force. In that this is really what is needed to really try to continue the dialogue, continue the collaboration, and really not forget that we need to collaborate with different youth organizations, but then go beyond the sector and really put in practice the multi-sector approach from the policy aspects, from the governance aspect, and then to the community level. And I want also to connect to what Pablo was saying before on the community empowerment, because I think that sometimes then the policy group, I can say, and then the community empowerment and the community level is sometimes divided. And I think that youth are really, they can be the bridge between community empowerment and then do activity and localization for a specific on AMR through different approach, as the One Alpha was also mentioned, and then the policy space. So having youth that are passionate and motivated and are expert, because youth are also experts on AMR, can be expert on AMR, then can be can build the bridge through their expertise, their innovation, their activities, through activities that are done at the local and regional level. And so really allow this community empowerment and bringing the community empowerment then to the policy space and be present not only in youth association, in, for example, this dialogue that we are having right now, but then also having and continue to have intersectoral but intergenerational dialogue and space, and really saying youth are experts, they can have a voice, they have a voice, and they can really bring the example from the community to the policy space and then bring a change on the AMR space. I hope I answered to all the different questions.
Thank you so much, Federica. So I definitely agree with the intergenerational, the intergenerational part that you talked about, because AMR definitely needs intergeneration dialogue as well as teamwork, because I believe, and I think everyone will agree, this problem, it outlives all of us. So it's only fair that the people who will face its consequences, they help shape the situation. And we also look forward to the commentary being published. So thank you for all your insights. And next, I would love to open the next question to the whole panel. So if you had to narrow it down to just one practical action that youth could take over the next few months to strengthen AMR policy or AMR accountability in their own countries and nations, what would you highlight and why? So I'd just love for, one of you to jump in and then the rest can follow.
Probably I can go first. So for me, one of the top priorities should be on the capacity building, but I would say already from the existing tools that has been implemented and developed. Because it's true in many cases, and also from my youth experience in previous organizations, we're trying in many cases to reinvent the wheel. And that takes a lot of time and resources. So what I would say from all the existing efforts that have been already implemented, how we can use them on our favor and in our local context for practical use. And I just wanted to also to share this quick milestone from the quadripartite working group that just during WOW, we had a paper accepted in Nature that it was the youth as change makers and antimicrobial resistance and evidence-based call to action that I will share in the chat. But I think this kind of initiatives or creating evidence from the youth perspective is also an actionable thing that has some outcomes, and of course then can be used as well for different levels of advocacy. And I highly encourage then the different youth organizations to focus on this instead of trying just to create things from scratch that is still is relevant, but probably just use the materials that are already out there to best use the time and the limited resources that we know that youth organizations have.
Okay, thank you so much, Pablo, and we look forward. I would love to read the publication, so do send it in the chat. And Professor or Federica, any of you wants to jump in real quick?
Yeah, I wanted to add to Pablo's, although I would encourage folks really part of actually, I think, in an educational process is to really start actually the process of becoming experts in these areas. We really do need the next generation of folks to take on some of these efforts, and that whether it's through your thesis or whether it's through your paper in a class or whether it's actually through a One Health Club, And so I think the first concrete action is to really translate this global sort of guidance that might be available into local, the systems analysis. So perhaps youth leaders might take it on themselves to size up where is the greatest potential leverage. And that depends on the local context. So I don't think that we've done a very good job at the global level making that translation. And so context matters. So what a focal problem or entry point you prioritize depends on how you are positioned. If you're a pharmacist in training or physician in training, or whether you're actually going to be next agricultural expert in your community, it's whether you're also going to be working within your sector or across sectors. And this is one of the issues that came up in the last, I think, last panel, was also, I think, this idea that we must really start doing a better job of working outside of our silos, across sectors. And that's often is not well captured in the global guidance. So I would simply, again, very importantly point out that where you stand depends on where you sit. But identify the gap more effectively in the local context. Look for the catalytic actually lever. You can, in fact, even go to things like, for example, if you're looking at the national level in your country, go to something like the Tracking Antimicrobial Resistance Country Self-Assessment Survey, or TRACS. They have a whole website as a memorable URL. You can see how your country self-reported actually its progress, and you can also take issue with it and find the data that actually would create policymaker change by actually looking where their data actually does not, in fact, coincide with the reality on the ground. But that website is very easy to remember. It's amrcountryprogress.org. amrcountryprogress.org. And you can search the data on your own country. Or you might look at the country situation analysis that served as background to shaping your national action plan. And then I think you can have to start applying the tools that we talked about a little bit earlier, both in that toolkit that Pablo mentioned, but also in our Innovate for Health, global student design sprint in the past. We taught teams of students to innovate ways to address emerging infectious diseases, size up these challenges, problem and objective trees, SWOT and stakeholder analysis, value chain analysis. Sadly, these tools are not taught very widely, but should be. And I think we should do a better job of actually equipping and the capacity building Pablo was mentioning our next generation to do just that. I hope that's helpful.
Yeah, okay, thanks so much, Professor. I definitely believe that the professions are really siloed, and that's why we formed the World Health Students Alliance to at least bring together the different students and young professionals from all the fields that are concerned with AMR. And kindly send the website link you were talking about, so that if anyone had any internet connection problem, they can definitely access it. And Federica, you're the last one, so I'd love for you to shed some light.
Yeah. I think that Pablo and Professor Anthony, they already said a lot, and it's very insightful and very inspirational. I think that I'm just gonna double what they said. I think that education and advocacy is really the key. Um, for being part of voice, again, we need to develop expertise. As I said, I think that you're already expert, but you can always develop and you can diffuse also the expertise. We need to talk more about AMR. We need, as Professor Anthony was saying, to go and also go to the local level, include the community in our awareness. And so I think that it's really like parallel ways. So on one side, all the education and the education, as I was mentioning before, the intersectoral, really the focus on the intersectoral, intergenerational, but then transform all of the education in advocacy and in awareness at the community level, for then bringing the voice of the community to the policy. So I really think it's a true way, and the education and advocacy is the key. This is what I wanted to add.
Okay, thank you so much, Federica. Even I believe that education is the very first step, because if we're not educated enough about AMR, we won't be able to advocate about the issue either. So thank you for bringing that up. And the very last thing, I like to ask, but first of all, like, we heard all of these ideas, about what youth can do in the next few months. So I'm sure a lot of our attendees are thinking about how you could take action in your own context. And with that in mind, I would love to open the floor to any questions our attendees might have. So if you have any questions, kindly type them out in the chat box, and we'll try to address at least two of them. So I'll give 1 minute to our attendees to type it out. Don't be shy. It can even be silly questions. It's not a problem.
Maybe while they're typing out the questions, maybe we could offer some ideas of where, in fact, are some specific local context ideas. Would that be helpful, perhaps?
Yes, we'll just wait for 1 minute. If we don't, we can definitely proceed to that. Okay, so we've got our first. Madhura wants to ask about the cohort study model practice, the use of the cohort study model practical. So is there anyone who'd like to address this? Or maybe she has to be clearer in what she wants, because even I'm not clear on what she wants.
I'm not sure I understand. I've got a little more explanation about what the cohort study model approach you're thinking about is. Are you referring to a study design approach? Well, I don't think there's anything special about the cohort study approach versus other approaches. Your methodology that you choose would depend, of course, on the particular intervention you're trying to actually drive. By cohort study, I'm not entirely sure whether you're referring to actually the nature of the sample that actually is being followed over time, as opposed to, I think, more significantly, you'd be looking to see whether or not you have to do something in a randomized control trial approach, which oftentimes is very challenging because you can't always randomize things in a lot of interventions that we do. So in those sort of situations, you're going to look for before after differences. And so your study design might use that kind of methodology, right? And sometimes you need to also pick a much smaller, actually, but still salient sample design for policymakers. You can't necessarily sample the whole country, but you certainly can do something actually in a significant actually health system within the country, for example, or within a set of, for example, pharmacies within actually a particular area, rural or urban, or an environment actually for urban informal settlements. So pick your sample strategically, and then you have to choose your sample, your design actually for it, whether it's cohort or otherwise, to actually address actually something that could be in fact easily collectible and most importantly, compelling enough to raise the next question for policymakers. Is to create that sense of discomfort for them so that they have to face an uncomfortable truth resulting from your study. I hope that's helpful and to addressing some of your question.
Okay, thank you so much, Professor, for the answer. We have another question from Parvin. So they want to know the best study approach for community research. So who would like to take this one up?
I can briefly answer this one. I would say that when we are talking about community research, the qualitative types of study comes into place really well. And it's true in many cases when we are taught about research, we mainly think about quantitative studies. But I would say especially on AMR, when we're talking about behavioral changes, the qualitative ones are really useful. Also, if we're doing any kind of impact assessment, especially on interventions on community, might be also a great approach. And for this, I just wanted and also to briefly mention or answer the next question from Fifi. Just wanted to share that there's also a really nice set of resources for youth engagement and overall for AMR, that it's the React toolbox that I'm not sure if it was mentioned in any of the sessions before. I just wanted to put it here because during our rotation that I did last year with them, we were able to co-develop this section on youth engagement resources. So probably for research might be interesting, but also to know what's already out there. So yeah, just share it on the chat if you find it relevant.
Okay, thank you so much, Pablo. So if Federica would like to talk about, in the long run, how youth engagement will help in bridging the innovation and implementation gap, because I think even I believe that this is a huge gap that exists right now. So Federica can take it, and then if Pablo, if you want to contribute, or if Professor wants to contribute, you can definitely talk about it.
Yes, I was actually reading the question in the chat. It's not that easy, I think, because it's always yeah, I don't know, I don't know if I'm answering the question or not, but because I also think, like we were discussing about some example, and I just want to bring here, I think that maybe it could actually also help then in answering this question. But I wanted to do an example of one of the job that I'm doing for the Italian Red Cross here in Djibouti, because the local national society is actually implementing right now a project that is focused on One Health. That is a part of actually a regional program. So it's a regional program for all the IGAD region, but then is localized in Djibouti and specifically in 3 community. And what the project is on, and I think it linked with all we said, right? It's training volunteers of the National Society or the Djibouti Red Crescent Society to actually be able to collect data, then empower the community to be able to collect data, train not only community leaders, but also like community leader for all the different stakeholders. So also people who are more in the livestock, for example. So this help then, or the aim is then to bring this data from the community level to the health center, and then from the health center there are committees that are now being built, and then this committee are the bridge to a higher level of the Ministry of Health. And then the Ministry of Health right now, they're actually, that the advocacy is actually starting from the ground, and they are pushing at the ministerial level to then start talking about One Health and then AMR at the national level. And this goes from the community, from the bottom, really to up, and then to the national level and to the regional level. So I wanted to share this practical example because it's really what I see daily, the community in power. And maybe this can also be linked with the I don't know, like in the long run, maybe bridging the innovation and implementation gap. So really try to connect what is on the ground, what the youth are doing on the ground, because then who is doing this job, who is being trained, and then link with the community, our youth and youth volunteers. And so I really think that this can be an example, like being able to use local organization to then empower community, but also take the innovation from the community. That sometimes innovation we go toward the digital, but it's not always digital innovation. It also find a way of really transmit what you want to transmit to the community level, and then take from the community what you want to take and you need from them, bringing that to the policy. So maybe that could help really know more also what are the local projects that at the end are part of a national and on a regional level. So really be able to go from the bottom to then up the national and regional. I don't know if this answered actually from the long run for the innovation implementation gap, but I really wanted to bring a practical example of a daily work that happened in the really remote village of this small country of the Horn of Africa.
I love what
Yeah,
Federica was
thanks so much.
saying. Can I just
Thank
add
you.
something?
Thank you.
Can I just add, Tassiver, that I think that this sort of example, how to make data actionable from the local level, is really critical. But oftentimes we need to take a step back and ask ourselves, as I think one of the questions asked, how do we actually, in some ways, I believe the question in the chat was about actually how do we actually make sure that in fact these kinds of actually efforts contribute to actually bridging this gap from advocacy to policy. And so I think we need to ask ourselves, what's the theory of change? So if A happens, then B will happen. And this gives you direction to what you're organizing. Spell out explicitly the causal chain. Now, it's always several steps usually, but if you cannot see actually where those steps lead, then you probably don't have necessarily the right actionable data to make that follow-on step. If you can vision it though, you're on the road to making that change. So, the theory of change for the chain reaction report also might have well been if one could change how food buyers, actually food animal products, actually source what they procure, then it would change the economic incentives for food producers to take the right action and limit the routine use of antibiotics in food animal production. That would have been a really good guess and a really powerful theory of change, which actually happened in the poultry industry. So again, I think we can do the same here for youth also engagement.
Okay, thank you so much, Professor. And we have very little time left for the meeting, so I do see a lot of questions in the chat box. I would like to request the organizing team to collect the questions so that we can mail it later to our speakers. And we'll definitely let you know the answers to our WhatsApp chat. And lastly, I would like to, ask all three of you to give some quick key take-home messages for our attendees. And please try to keep it limited to 1 minute each for each of you. So like Pablo can start.
Sure. So my home take message would be to try to work in networks or in groups. Of course, this individual work is really important, but I think when we work together for a common goal, we can see the impact become bigger. There's already a lot of networks out there or organizations, and if not, I would highly encourage you to create one. And I think just having this kind of spaces is already quite important, but we have to make sure that we maintain them, because we cannot give for granted that the youth representation that we already have in these high-level spaces are going to continue. So we have to keep vigilant that these spaces are still happening. And for that, we also need a renewal, generational renew. So yeah, you're gonna be the next AMR leaders. So yeah, let's keep on working as a network for a healthier future. Thank you.
Perhaps I would go next then. Is that right, Tover? Okay. Well, let me close on a principle. Accountability isn't something governments do for its citizens. It's something citizens do to governments. And I would not wait for a global action plan on AMR to set locally meaningful targets. That's all on us. Work on the system's failure, identify the gap, set a target, create a theory of change, and lay out a plan for delivering using approaches like the FOG behavior model and those actually captured in the youth engagement handbook developed by the quadripartite. Your clinical placements, your research, your community health work will situate you in the middle of where behavior can change and can generate AMR data. Where you stand, where you act, depend in part on where you sit. And the question is whether it stays siloed or becomes leverage for change. So what I hope you leave this Global AMRU Summit with is a commitment to set your own targets that hold yourself and your organizations accountable in a year's time, not just for getting back together, but to make change. Come back to the summit in 2027 with projects that report back actionable data showing that because youth got engaged, the policy needle moved. Like every generation before you, the weight of this responsibility can sometimes seem insurmountable. But remember that your best days are ahead of you, not behind you, that there is time to climb the mountains and tackle the challenges left by generations before you, that you are at the beginning of life's journey, not approaching its end. And I wish you the best in that journey. Thank you very much.
And I think it's then an honor to go after this really motivational speech. And I think I'm just going to repeat. And I think that the key message is that collaboration across sector, across generation, but also across different level of governance is essential for an effective AMR response. We need to empower a community on the ground. That's the example I was doing before. But then what Pablo said, we need to continue ensure that youth have a voice in global platform. And I really like what you said, actually, that we cannot take for granted that space. So we need to ensure that we have youth voices in global platform, and we need with this empowerment at the community. And then at youth level, we can build really AMR strategies that then are equitable, but also are then grounded in reality and then are really concrete and reflect then the local needs. So this is my key message.
Thank you so much, Federica, and everyone, all the speakers in the panel. This was like really insightful for me, as well as I hope for the attendees as well, and for a very interesting roundtable discussion. Thank you so much again. And before we call it off, can we just have a quick picture and everyone can switch on their cameras? Okay. Okay, thank you so much for all switched on the cameras. I'm taking the pictures. So 1, 2, 3, go. Okay, thank you so much everyone for attending and to our speakers. And we definitely look forward to further collaboration with all 3 of you. Thank you so much for attending.
Thank you, everyone.
Thank you.
Thank you.
Bye-bye.
Okay, so now I'd like to give the floor to the moderator or the coordinator for the panel sessions. So you have the floor. Thank you.
Hi, everyone. We will be having 3 parallel sessions now. The first one will be on AMR and food security, the second one on AMR and sepsis, and the third one on AMR and global surgery. We will go into breakout rooms where you will see also the speakers and we will introduce them there. So I will open the breakout rooms now. In the main room, you will stay if you want to be, if you want to participate in the AMR and sepsis, and then we'll open 2 rooms for AMR and food security and AMR and global surgery. The rooms are open now. You can choose the room that you want to participate in. If you have any difficulties, please type in the chat so we can help you. If you want to participate in the session for AMR and sepsis, please stay in the main room. If you want to participate in the session on AMR and sepsis, stay in the main room. If you want to participate in the session for AMR and food security, go in the first room. And if you want to participate in the session for AMR and global surgery, please go into the second room. If you have any difficulties, please type in the chat. We will help you out. Just mention the session that you want to participate in. There are two breakout rooms. One is for AMR and food security. The second one is for AMR and global surgery. You can join if you want to participate in any of these sessions, and the other session that's happening here in the main room where you are in at the moment is AMR and global surgery, so you don't do something if you want to be in this session, you just stay here. If you have any issue with joining the breakout rooms, please let us know. Okay, I think we can start here. One moment. Okay, I think we can start. I repeat that this is the session on AMR and sepsis, and we have with us Dr. Mariam Zassi. So Dr. Mariam Zassi is the CEO of the Global Sepsis Alliance, and she brings 27 years of experience in global health across Europe, Central Asia, Middle East, Sub-Saharan Africa, and North America. She has served as a member of the parliament, chairperson of the parliamentary committee, deputy minister of health of Georgia, and president of the Innovative Financing Secretariat hosted by the French government. Dr. Jassi is the global board member of the UNITE Parliamentary Network, the Secretary General of the Medical Women's International Association, in the advisory board chair of the Tbilisi Medical Academy, a member of the UHC 2030, political panel at WHO, and council member of the Virchow Foundation. Her earlier experience includes 12 years of humanitarian development work with UNICEF and UNAIDS, as well as technical advisory roles with Gavi, the World Bank, and other UN agencies. Mariam Jassi is a Mason Fellow of Harvard Kennedy School and the recipient of the WHO Award for her contribution to polio eradication in Europe. Mariam, it's a pleasure to have you here. And thank you so much for taking the time on a Sunday to be here with us and share your experience. As you saw, everyone has very broad experience in various topics, and we are really looking forward to your insights. Thank you so much.
Thank you, Anna, so much for the introduction, and it's my absolute pleasure and honor to join your summit. And it's wonderful that the Global Sepsis Alliance and the International Federation for the Medical Students Associations are starting our collaboration, and we look forward to further exchanges. I extend greetings to every young colleagues attending the session. And I would love to first start with the set of PowerPoint presentation where we can discuss both. I will use the opportunity to introduce the Global Sepsis Alliance work to our audience and then speak about the critical linkages between sepsis and AMR. And
I think your connection was cut, so please be patient. Give us a few moments. Mariam, your microphone is closed.
Sorry, Anna, dear colleague, sorry. I somehow entered the other room, a technical kind of dilemma, but I hope now you can see my presentation. And so let me use the opportunity to introduce the Global Sepsis Alliance to our audience and then discuss the critical links between AMR and sepsis. So about the Global Sepsis Alliance, the GSA is already 15 years old, and this is the largest
Mariam, your microphone.
Anna, I think that yeah, the admin is maybe muting my microphone, but I will check out. 15 years ago, Professor Konrad Reinhardt, who is standing next to Margaret Chan, the former Director General of the World Health Organization, established the organization. And the Global Sepsis Alliance is the largest professional and advocacy network in the field of sepsis. GSA established the World Sepsis Day movement, and if you have ever participated in advocacy or training or awareness-raising activities around sepsis on September 13, GSA is the initiator of the day, and currently we have 54,000 stakeholders engaged in this global movement from 174 countries. The Global Sepsis Alliance was also the lead organization who advocated and contributed to the development of the historic sepsis resolution in 2017, the World Health Assembly resolution. And one of our flagship initiatives is the World Sepsis Congress, completely online congresses that usually we convene in April. And next April, we will be hosting the session on April 22nd and 23rd. And from 2016, we have reached 122,000 healthcare providers, policymakers, and sepsis advocates. GSA, and this is the example of our last Congress, and we are honored for having special video address from Dr. Tedros Ghebreyesus, WHO Director General, and some of the high-level politicians, including the ministers, members of parliaments, and some of the key decision makers in global health. The GSA currently has 122 member organizations globally, and we have 6 regional sepsis alliances, including African, European, Asia Pacific, Eastern Mediterranean, Caribbean Sepsis and AMR Alliance, and Latin American Institute for Sepsis that was established even before the GSA, and this is one of the strongest regional alliances, but they de facto are our branch in the Latin American region. Global Sepsis Alliance provides technical support to governments, WHO, and other stakeholders through contribution to the development of the guidelines of WHO, for example, that are currently under development, as well as the latest international consensus criteria for pediatric sepsis and septic shock. And most importantly, we have one of the strongest and the widest network of sepsis survivors and families who have been affected by this devastating medical emergency. And on the slide, you see Shahrazad Kievash, sepsis survivor from Sweden, double amputee, as you can see, who after surviving a critical sepsis episode, she became an athlete and participated in Rio Olympics competitions. She's an amazing advocate and speaker. On the right-hand side, you see Ilse Malfate, also the sepsis survivor. Ilse is sepsis and cancer survivor who has spent 480 days in septic shock and post-shock rehabilitation in hospital and had to undergo through 22 surgeries. And after surviving this life-changing episode, Ilse became the person who made a real change in her home country, Belgium. A special TV documentary was made about Ilse's case, and she was the single voice who managed to convince the Ministry of Health to put together a multidisciplinary experts team on sepsis, and Belgium now has the first national report on sepsis. In the middle, you see Quan Brown, 18-year-old Australian guy who unfortunately could not be saved. But his father, Duncan Brown, is the co-chair of the Global Sepsis Survivor and Family Committee, and he is an amazing advocate and friend, supporter, and co-fighter of the Global Sepsis Alliance. And we are extremely grateful that after truly life-changing, shocking experiences, these families are standing with us to raise awareness, to really reach decision makers, policy makers, to understand that sepsis is still unrecognized global health threat that needs much urgent attention. And we will speak about the global burden later. The 2030 Global Agenda for Sepsis, this is the document that we developed last year This is the first multi-year strategy how to tackle one of the most challenging global health threats, and how we can turn the sepsis fight into the next success story in global health, similar to immunization, HIV, TB, malaria, and other global health priorities. And this document was launched at the German Parliament last year, and we had the honor of having a special video address from Dr. Tedros. If we are able to implement the 2030 global agenda for sepsis, we can save at least 2 million lives every year, prevent 12 million sepsis cases annually, and reduce the economic burden from 36,000 euro currently on average to at least 29,000 euro per patient. And this is also an opportunity to let our colleagues and the future health professionals know that Global Sepsis Alliance recently, literally in November, opened its doors to individual membership. Medical students can become associate members of the Global Sepsis Alliance, and you will be also able to receive the special certificate of membership to the organization. So please, if you think that you can contribute to saving millions of lives every year in raising awareness about sepsis, please, Global Sepsis Alliance would be delighted to have you among our members. Now about the theme of our today's discussion, sepsis and AMR. Let's first start with reviewing the global burden of sepsis. The landmark Lancet publication in 2020 for the first time documented the modeled estimates on sepsis, and it said that every year sepsis affects 48.9 million, almost 50 million children, women, and men globally. And sepsis accounts for at least 11 million deaths every year. And these estimates are recognized by the World Health Organization. And if you go to the sepsis fact sheets and the sepsis webpage of WHO, you will see these estimates. Sepsis is accountable for every fifth death worldwide. 85% of the burden is in low and middle income countries, and 40% of the global sepsis burden is among under 5 children. More than 20 million children are affected by sepsis every year, mostly in sub-Saharan Africa and Asia. And we are losing almost 3 million children to sepsis. And the question that as a former minister and a former parliamentarian, I still find very difficult to find the answer to. How can we have a global threat that takes every fifth life worldwide, 11 million deaths at least every year, and we don't speak about sepsis in every major global health forum? And sepsis is still invisible. The cause of 20% of deaths worldwide is still invisible in the global health dialogue and architecture. So as the medical students, as the young professionals, please join our efforts to raise awareness, because having been in global health for the last 27 years, having seen how we were so successful in scaling up HIV, hepatitis, immunization, malaria programs, sepsis should be the next major forerunner of the global health priorities, and we hope that we will make the difference through concerted efforts. Let me also share the publication that was launched in October by the Institute of Health Metrics and Evaluation. This is the same team of collaborators that produced the 2020 Lancet publication. Last month, we received the up-to-date estimates of sepsis burden that is based on the 2021 data. That is a pandemic-related data, and hence we see substantially increased estimates. Based on the latest publication that are co-authored by some of the brightest minds in the global health and global statistics and modeling, the Washington University and Oxford University, in 2021 alone, estimated 166 million cases of sepsis were reported globally. And sepsis was responsible directly or as an intermediate cause in 21.4 million deaths. And please search for the publication and you will find some amazing analysis that we're absolutely sure you will find extremely interesting. Based on this latest Lancet Global Health publication, sepsis is responsible, all-cause sepsis-related deaths are responsible for 31.5% of total global deaths. So if WHO currently recognizes 20%, this is the latest estimates. But even if we have the cause of 20% of deaths, we believe that sepsis should be much higher position, much more visible in the major global health estimates. Now, the main slide of today's session, why it is important to speak about sepsis and AMR. And I'm sure you have already seen some of the numbers about antimicrobial resistance from previous speakers and presenters. And when we speak during the high-level meeting of the UN General Assembly last year that adopted the AMR political declaration, we all knew that in 2019, overall, AMR was contributing or associated with 4.95 million deaths and 1.27 million was directly attributable to AMR. And even last year, when all global health leaders, all political leaders were speaking about antimicrobial resistance and adopting the historic declaration, very few knew that these data, these estimates are also stemming from the same modeling exercise of the global burden of sepsis that Institute of Health Metrics and Evaluation have authored. And finally, the slide that you should remember and please replicate and raise awareness about. Today, WHO and all global leaders engaged in antimicrobial resistance advocacy and policy or clinical level action or research and development, they speak about 4.71 million deaths associated with antimicrobial resistance, including 1.14 million deaths directly attributable to resistance. And this is part of the 7.75 million bacterial infection-related deaths. But the broader umbrella, the largest circle in this analysis is sepsis. The 4.71 million AMR-related or associated deaths are part of the 21.36 million sepsis-related deaths. So when we speak about antimicrobial resistance and we don't speak about sepsis, this is either a lack of understanding the critical link or lack of maybe like clinical reasoning or in-depth analysis. And this is the phrase that I would like you all to remember. Sepsis is the human face of AMR. Sepsis kills, as a result of antimicrobial resistance. And as you can also see from the slide, when we speak about 4.71 million deaths, that is a huge death toll globally from antimicrobial resistance. Still, we can save 17 up to 70 million people from sepsis that are not related to resistance. So our appeal to you is to, of course, we should join forces in advocate for antimicrobial resistance, because AMR itself has substantial challenges that we have to jointly overcome, including the lack of very limited pipeline of antimicrobials that are in the future and reserving the life-saving antimicrobials. But at the same time, we have to synergize policies and actions on AMR and sepsis. And one of the paradoxes that I would like you to also remember is that today we're extremely delighted that 180 countries have developed national AMR plans that includes strategic pillars based on the quadripartite agreement between WHO, FAO, and other UN agencies. But only 15 countries, 15 countries globally, have a standalone or integrated sepsis strategies or action plans. So that is also an area that we have to synergize our actions. And I would like to also introduce to you one of the most helpful resources in terms of estimates on antimicrobial resistance and sepsis. WISHub, and you can see the link below, from the Institute of Health Metrics and Evaluation and University of Oxford, they have developed the database where you can find sepsis and AMR estimates for every single country and every region. So please visit the site, browse for your country and see what are the latest estimates on AMR and sepsis. And that could be very helpful in your day-to-day advocacy or any other presentations, awareness raising efforts or analysis. As an example, I'm originally from Georgia, and based on this data set, only in 2021, more than 19,000 deaths in Georgia were related to sepsis, that including 2,700 deaths associated or attributable to AMR. So I very much recommend and encourage you to use this database. And you can also find amazing analytic tools for creating time-bound analysis, how sepsis and AMR profiles for different countries or regions have evolved. Now, when we speak about the clinical level, why it is on the policy level and on the global burden level, I believe that we have concluded the critical link between sepsis and AMR and how we have to synchronize the action, advocacy, and the voice for AMR and sepsis fight. At the clinical level, why it is important to have a balanced AMR stewardship during sepsis. Global AMR action plans and all the literature that you will find about antimicrobial resistance, of course, one of the key points is to avoid unnecessary use of antibiotics. Rational use of drugs is key for preserving the life-saving antimicrobial agents, both antibiotics, antiviral, antifungal, antiparasitic, so all kinds of antimicrobials. But when we speak about sepsis, and this is the slide from one of our member organizations, the UK Sepsis Trust, and I would also note that UK is one of the exemplary countries how sepsis has been managed at the national level, starting from the national guidelines to advertising and posting the sepsis signs and questions, could it be sepsis, at every ambulance and emergency rooms. So when we speak about the first hour life-saving bundle, the so-called sepsis 6 bundle, intravenous antibiotics is one of the 6 life-saving interventions. So how to balance, on one hand, avoiding unnecessary use of antibiotics, and on the other hand, administering antimicrobials immediately without a delay once we have suspected sepsis. Another fact that I would like you to remember is that every hour of delay in administration of antibiotics during sepsis increases the risk of death from 0.4% every hour to as high as 7%. Different studies have indicated the different range of mortality risks that increases per hour of delay of antibiotics. That is why timely detection and timely administration of both IV fluids as well antibiotics and measurement of the blood culture, lactate and urine output, as well as administration of oxygen are the vital steps to be taken as soon as possible. If we dive deeper in AMR stewardship, those are some of the critical steps that we have to bear in mind. So whenever sepsis is suspected, we have to start with broad spectrum of antibiotics as soon as possible, but with a purpose. So starting rapidly the broad spectrum IV antibiotics at time 0 when sepsis is suspected, and choosing agents based on likely infection source, patient risk factors, local resistance trends at the clinical level, if we don't have access to 24/7 lab or culture identification possibilities, and also recent microbiology history of the patient. In parallel, we have to ensure source control measures, reducing bacterial load that also reduces the demand for antibiotics. And the examples of source control, of course, you are aware, is the draining of abscesses, for example, or removing infected lines, debriding necrotic tissues. If possible, culture, the blood culture, urine and sputum should be obtained even before administering the first dose of antibiotics. However, if culture before the first dose is impossible, we have to start antibiotic administration as soon as possible. And early de-escalation of antibiotic or antimicrobial overall therapy is one of the most important stewardship steps. Within 24 to 72 hours, when microbiology data becomes available, we have to step down from broad spectrum to narrow spectrum, stop unnecessary agents, move from IV to oral formulations when appropriate. And the right dosing, right duration, and monitoring is also vital throughout the stewardship phase of the sepsis management. And the basic principle is the shorter effective duration is, of course, better, both for the patient as well as for the prospects of preventing further multi-drug resistant pathogens. I would also very much recommend our participants to look for the WHO resources on antibiotic resistance, the causes of antibiotic resistance, of course, and the strategic approaches in terms of avoiding overprescription of antibiotics, completing the therapeutic regimens during the treatment, avoiding overuse of antibiotics in livestock and fish farming, the pure infection control, logistics and clinics, and lack of hygiene or pure sanitation, as well as the watch out for the new antibiotics in the pipeline. And on the right-hand side, you will see WHO's latest guidance, AWARE, access, watch, and reserve, that I'm sure each of you will find extremely informative as well as practical. On the left column, in access column, you will see the group of antibiotics that should be ensured as empirical access and readily available at every level in every resource settings. The watch column in the middle, in the yellow, are the group of antimicrobials that have the higher risk of resistance development. So we have to be a bit careful with using those groups of antimicrobials, for example, the third generation of cephalosporins. And the red, on the right-hand side, you will see the reserve column. The reserve column are the antimicrobials that are left as the last resort in infection disease management, and we have to be extremely careful in using those groups of antimicrobials. Please see the publication, and I'm sure that you will learn a lot of useful information and the latest recommendations from the World Health Organization. Finally, I would also like to touch about the special considerations of AMR and sepsis in immunocompromised individuals. As you know, newborns, children, women, older adults after 65 years of age, as well as immunocompromised individuals, are especially susceptible to multi-drug resistant infections and sepsis. And I would like to share a few slides about sepsis and AMR in cancer patients. 9.1% of cancer patients develop sepsis. That is the latest study from Ture and colleagues. 1 in every 11 cancer patients develop sepsis. Cancer patients have almost 10 times higher risk of sepsis and 3-fold higher risk of drug-resistant infections compared to non-cancer patients. Risk factors for antimicrobial resistance and sepsis in cancer include previous antibiotic exposure, invasive procedures like catheters or mechanical ventilation, stem cell transplantation, and ICU hospitalization. And sepsis is a major mortality driver in oncology, increasing 90-day mortality 13-fold in hospitalized cancer patients. And carbapenem-resistant and multi-drug-resistant organisms increase the mortality among cancer patients by 10 to 15 times. Despite improvements in survival in survival of cancer patients, mortality remains higher in hematologic malignancies versus non-cancer sepsis, even with modern care. And this is the latest data from Australia and New Zealand ICU cohort. And we've seen in practice, both in pediatric oncology and adult oncology, that even after successful surgical, radiological, or chemotherapy, we lose patients due to multi-drug resistant infections and sepsis. And that is something that we also have to be extremely careful and aware of. Finally, this might be also new, so I'll try to select some of the slides that I hope would be bringing something new to our audience. When we speak about pandemic risks, did you know that 78%, almost 80% of adult patients in ICU during COVID, like COVID patients, had viral sepsis? They met the sepsis criteria. Unfortunately, we didn't hear a lot of discussions about sepsis. We've heard about severe infections, but not specifically the term sepsis. And there have been striking similarities in clinical manifestations, clinical outcomes, and long-term sequelae between severe COVID-19 and sepsis caused by other pathogens. And research and development in precision sepsis care should be at the heart of pandemic mitigation planning to provide pathogen agnostic means to reduce mortality. What do we mean? Every future pandemic will increase sepsis risks. And the immunomodulatory and systemic inflammation, the chain that starts during sepsis are strikingly similar, irrespective of the pathogen. So for any future disease outbreak or pandemic, we have to be ready with better early diagnostic, surveillance, AMR stewardship, and sepsis clinical management skills. That will be key for saving lives during any future pandemic. Unfortunately, we haven't seen sepsis in the latest pandemic treaty, but we hope that with our strong advocacy, we will be able to convince the decision makers and global health leaders that sepsis should be core both to AMR and pandemic-related discussions. And since we have concluded the World AMR Awareness Week, I also recommend our audience to see the recorded sessions on AMR and sepsis, including diagnostic innovations and targeted therapy that is available through the Global Sepsis Alliance website. And you will see 3 sessions, AMR and sepsis in cancer patients, and special session on antimicrobial stewardship, where Dr. Ivan from WHO also speaks about the latest guidance from the World Health Organization. And you will hear some of the amazing stories, both from the patients and the experts on different aspects of AMR and sepsis. Let me conclude here, Anna, and I look forward to any questions that we may have from our audience.
Thank you so much, Mariam, for your presentation. I think you really touched on very critical points, and this is exactly why we wanted you for this session. It's very important to raise awareness and understand what is happening in a global level right now with sepsis and how it is connected with AMR, because AMR was highlighted a lot also last year in the UNCA. But as you mentioned, sepsis is not always there in the discussions, while it should be. So we will move on. If we have any questions from the participants, please type in the chat or raise your hand. Salman? Salman, take the floor. You can open your mic, I think, right? Oh, you can't unmute? Oh, sorry, I unmuted you. Yeah.
Okay, now I can unmute myself. Thank you so much, Anna. Thank you so much, Dr. Mariam, for the insightful presentation. I'm Salman. I'm a medical doctor based in India. I'm from an organization called React Asia Pacific, and I'm a proud Alpha Cell alumnus as well. I rightly agree with the fact that you mentioned that sepsis is the face of AMR. So my question to you is, did you personally or your organization face any specific challenges in giving this face a voice? I'm asking with the context of, to learn your lessons so that we don't repeat the same mistakes, or, we don't come across the same hurdles that you did in an individual or an organizational capacity. Thank you.
Thank you, Salman. Wonderful question. Absolutely. I've joined the Global Sepsis Alliance 2 years ago, and I'm not the sepsis expert. I'm the policymaker who tries to put sepsis on the higher political agenda. And over the last 2 years, we've seen a lot of barriers in positioning sepsis as the critical link to AMR, because the end point, unfortunately, the apex of the AMR kind of deterioration and the AMR-related death is, of course, is sepsis. But we also see some progress, because now when we hear some of the presentations from World Health Organization or some other global health leaders that speak both on AMR and sepsis, that is already very encouraging, but we have a pretty long way forward. Very frankly, it's very difficult to explain the resistance to discuss AMR in conjunction with sepsis, because it is so easy to really put sepsis as the human face to AMR. I even have a real life story. Last year at the UN General Assembly, a high-level meeting, as you know, 194 UN member state delegations participate in the special session of the UN General Assembly on AMR. And when I was entering the security guy was apparently tired of, checking all the country delegations and still couldn't question anyone. So somehow he approached me and he asked me, like, Madam, what is AMR? Because AMR was the first time that was on the agenda of United Nations. And of course, I was delighted to explain AMR is antimicrobial resistant, and still his face hasn't changed. He said, and what does it mean? And then I explained, AMR is when antibiotics do not work and you can die from sepsis. And then he smiled. Now I understand. So when we speak about AMR, you will see, putting AMR in sepsis should be much easier, but I also understand that because we have this challenge of very limited pipeline of antibiotics, we also have a very strong voice of research and development partners. And I believe this might be one of the reasons that sepsis is relatively less represented in the discussions. But let me also share with you that the famous American actor and filmmaker Bill Pullman is currently producing a documentary, Antimicrobial Resistance. And after meeting him at one of the scientific conferences in Vatican, and after explaining to him the importance of sepsis and AMR, he has integrated the sepsis theme in the documentary, and we hope to see sepsis much more visible in this very important historic documentary.
Thank you so much, Mariam. Any other questions? I think Prince had their hand raised, or you can type in the chat. We had a question earlier. I'm trying to get back in the chat. It's a hypothetical question from Stephanie. COVID-19 mutates, and even though some of us have taken boosters, can this COVID-19 associated mutation lead to AMR and sepsis? How can we take measures on this? Or like hypothetically in any other situation similar to this one?
Actually, when we speak about sepsis prevention, every single vaccination is an important protection from vaccine-preventable infections that can lead to sepsis. So when we speak about sepsis, every infection can become the source of sepsis. So vaccination against traditional antigens, starting from DPT or MMR, is equally important as the new and underused vaccines. So my recommendation is very clear. Every vaccine that will be recommended or pre-certified by WHO or other major global or national drug authorities should be scaled up to its maximum. In terms of multi-drug resistance and mutation, of course, there is always a risk. Unfortunately, I'm not aware of specific figures or estimates of the resistance, but clearly immunization is one of the best protections. So I would first start with immunization, and let's wait for the new evidence to come.
Thank you so much. I think we are on time. So if you would like to share, Mariam, some closing thoughts and some points that our participants would take as take-home message from this session.
Absolutely. First of all, I've seen one of the messages, one of the colleagues was asking about how you can join the Global Sepsis Alliance. If I can share with you our website, 1 second. So if you go to the Global Sepsis Alliance website, that actually is the global, if you print the Global Sepsis Alliance, you'll see. So here are all the links to the webinars we spoke about, the sepsis and AMR, and you will have some of the amazing speakers starting from Australia to Canada and also African region. And join the global movement to fight sepsis. You will see the individual membership platform. And we tried to make this as accessible as possible for everyone in low and middle income countries. So you can become the associate member or a full member and an honorary member. And so those are some of the packages that you can receive, and every member will receive the certificate that will be void for 12 months. It's like annual membership fee. And medical students are welcome to join as associate members, because we also want to make this as affordable as possible for every of our community member. And let me also share with you some of the resources that I hope you can find helpful.
Mariam, we have a question. Sorry for interrupting you. If also students of other professions can join as associate members, is it open to everyone?
Everyone, irrespective of the profession, because we have sepsis should become the household term. Every family, every community should be able to identify the early signs of sepsis. And that's why, irrespective of your profession, every advocate is welcome to join. And also, let me share with you, you can see both on the Global Sepsis Alliance, but also the World Sepsis Day, you can see the toolkits and infographics, sepsis fact sheets and infographics in different languages that you can use for your training purposes, your advocacy purposes. And if you have any questions and if you would need any information from the Global Sepsis Alliance or the World Sepsis Day movement, we would be delighted to share.
Perfect. Thank you so much. We're going to wrap up the session because we are on time, but it was really a pleasure to have you here and talk about sepsis. I think that it was very interesting. Oh,
yes.
Prince.
Yes. Mm-hmm. Mm-hmm.
Prince, can you hear us?
Hello,
Hi.
can you hear me now?
Yes.
Okay, thank you, everybody. Thank you for the presentation. I just have a small question about sepsis. What is the most important thing to do when to prevent sepsis in rural environment? Because there are some of the places in Africa, for example, you can be challenging this kind of the situation where you don't have material or things to do. For example, in the forest, you find somebody with sepsis. So, what the most things? How we can prevent sepsis where we don't have possibilities to treat or to make the or to save somebody who is in sepsis. Thank you.
Thank you for
You got my question?
yes, thank you.
Thank you.
We are well aware that low and middle income country settings are especially vulnerable to sepsis, but both in high income countries and low and middle income countries, the key is prevention. And when we speak about prevention, as I mentioned, immunization is one of the most important strategies to prevent any kind of infection that can lead to sepsis. So luckily, the modern medicine provides access to some of the most high impact vaccines. Water and sanitation, so hygienic principles is extremely important. And if we have an open wound, of course, the basic antiseptic or cleaning procedures of the wounds is key for preventing infections. So if we are strong in scaling up immunization, water and sanitation principles, and infection prevention and control measures, both in community and healthcare settings, the vast majority of sepsis cases can be prevented. But if the sepsis is still suspected, of course, immediately referral to the first available healthcare center or community health center in the case of African or other low and middle income countries is essential. And the first hour 6 sepsis bundle administration that includes IV fluids, even broad spectrum antibiotics until we can have the capacities of pathogen identification.
Okay, thank you so much. I get you. So clear. Thank you.
Thank you so much. And I think with this, we can close the session. I see the rest of the people are joining back. Thank you once again, Mariam, for being here. It was really a pleasure, and we hope to future collaborations with from our side, from our alliance with yours, and working on AMR and sepsis overall in the future. Thank you so much.
Thank you, Anna, and we look forward to hosting our joint session for medical students on sepsis and AMR in mid-December. And we will, of course, announce the event in a due course. And it has been an absolute honor and pleasure. Thank you for the invitation. And again, there were a couple of questions in the chat. All contact information, all details about how you can become the member of the Global Sepsis Alliance or join our advocacy is available through the Global Sepsis Alliance website. Thank you.
Thank you so much. Have a nice day.
All the best.
And I think everyone is back from their breakout rooms. We hope you enjoyed, and we're going to move forward with the final part of our event. That's a war.
Yes, that will be me very quickly jumping in. Hello, everyone, and welcome back to the main room. Can we please confirm that everyone has joined the main room once again, so we can start with our closing ceremony? All right, I see most of you present. So, well, good afternoon, good evening, good morning, everyone. It is my greatest honor to welcome all of you back to the main room for the closing ceremony. And before we go into all of the speeches, I would like to give the floor to Ms. Tassavur to present to you the Youth Manifesto that was basically the result of this Global AMR Youth Summit and that has been drafted with all of your input. So, Ms. Tassavur, the floor is yours.
Thank you so much, Violet. I will also request Anna to share the screen. Okay, I hope everyone can see the screen. So of course, Violet said before we get into the closing ceremony, so I just wanted to take a few minutes to walk you through the AMR manifesto. So what it actually is, how it came together, and what young people, that is you, across the One Health spectrum are telling us. So first, what exactly is this manifesto for those of you who do not know what a manifesto is? So it's not a long academic document. So it's basically a snapshot of what almost 1,000 of you from medicine, pharmacy, vet, dentistry, agriculture are experiencing right now in your own countries when it comes to AMR. So I would like you to think of it as, what does the next generation of the One Health workforce actually see on the ground, and what do they want to change? So how did we build it? So you would remember when you registered for the summit, we added a survey to the registration form. So that wasn't an accident, it had a purpose. We wanted the manifesto to reflect real voices. We wanted the manifesto to be evidence-based. We did not want to, maybe have just our perspective or maybe just engage in guesswork. So we ended up with about 975 responses from over 50 countries across Africa, Asia, Europe, Middle East, and Americas. And it was all a mix of students, interns, early career professionals, so people who were already encountering AMR in, say, farms, hospitals, labs, and communities. So we asked about four big themes. Firstly is youth involvement in AMR governance and accountability. The second was AMR education and practical training. The third is behavioral and social drivers for AMR. And the very last is research, innovation, funding, and partnership. So, like I said, the first one was about governance. And what we collected from your responses was youth are being heard, but we're not really being given power. It may be on a global level, but not when it comes to our national governments or even our state governments. So most people said they are consulted sometimes, but only a very small group actually had said that they have a real defined role in AMR decision making in their country. So I can say that the message basically was, if you want youth input, don't call it last minute. Give us proper seats, proper roles, as well as proper continuity. So this was like a basic just for pillar one, that was governance and accountability. And the second big area that we focused on was education. And most people said that their education regarding AMR was either very basic or scattered across subjects. And only a few got proper hands-on practical training, and almost everyone said that interprofessional collaboration is rare. Like medical students never meet agri students, pharma students, they don't get to work with veterinary students, etc. So the youth perspective was, if AMR is One Health, then our education, it should also feel like One Health, and it should not be siloed. The third pillar is related to behavioral change. And this was really, really interesting because this is one of the aspects of AMR that is very interesting to me as well. So young people, they see what's happening in their communities. So we see self-medication, we see leftover antibiotics, unregulated sales, or people not even having access to a registered medical practitioner. So they just buy whatever they can. You have misinformation, all of it. So many of you are already doing awareness campaigns. We also do that. But the main problem is that most campaigns, they just stop at awareness. And you will also agree that there's no long-term support, no resources, and they don't really reach the rural or the areas that are not accessible via internet. So again, you all were basically saying we're doing the work, but the system around behavioral change needs to be much stronger. And then the last one is innovation and research. And this definitely came up repeatedly. So we have ideas, we want to contribute, but three things like they kept getting highlighted, that funding is limited, laboratory access is limited, and mentorship is limited. So most of the time, people just rely on personal networks or pure luck to get a project going. So the ask here was very clear from you guys that you want proper long-term support to actually work on AMR and not just one of competition, but you require real support. So just to end it, so what it actually means, if I had to summarize the entire manifesto in one simple line, so it's this, that we the youth, we do not want to be included symbolically. We want structural inclusion, and not just because we're young, though we are young, but not just because we're young, but because we are the ones who will be dealing with AMR every day for the next 30, 40 years and decades to come. So the manifesto, in a nutshell, is basically saying give youth real roles, fix the education gaps, support behavioral change properly, and definitely invest in youth health, in youth-led innovation. So again, the nice part is it isn't just demand, it also includes what we commit to ourselves, that is working across sectors, being evidence-based, engaging communities ethically, and holding ourselves accountable too. So that's it. That's the heart of the manifesto, and it's the collective voice of what we can do and what we are experiencing, what we want, how we want the AMR system to look like in the future. So that was it about the manifesto, and I'll give the floor back to Violet to continue with the closing ceremony.
Thank you so much, Tasawwur, for sharing with us the manifesto. And I saw all of the many comments in the chat. Don't worry, the manifesto will be made publicly available very soon. So yeah, without further ado, I would like to move on to the official closing ceremony, which will conclude this session. So dear participants, as we reach the end of these 3-day transformative days of the Global AMR Youth Summit, I find ourselves reflecting on the energy, the ideas, and the honesty that have filled this space. If there is one message that has echoed through every plenary, panel, roundtable, or even workshop, it is this. We are no longer preparing for the future, we are already shaping it. And the decisions we make after leaving this room will definitely not shape only our professions, but the world we pass on. So throughout the summit, we explored antimicrobial resistance through the lens of every WSHA discipline represented here, being medicine, veterinary medicine, dentistry, pharmacy, and agriculture. What struck the most is that despite our different backgrounds, we kept arriving at the same truth. AMR does not stay in one field, and neither can our solutions. It crosses borders, species, environments, and systems, and real progress will only come through genuine cross-collaboration. Not collaboration written in strategy documents, but collaboration that is lived in practice. So in classrooms, clinics, farms, laboratories, ministries, and our communities. We also heard clearly that the urgency of the issue leaves no room for hesitation. The science already tells us where stewardship needs to improve and where systems need strengthening. So the data, research, and evidence are actually already there. What is missing is not the knowledge, it is the action. And if this summit reminded us of anything, it is that advocacy cannot be an afterthought. Stewardship cannot wait for the perfect moment, and policy change can be someone else's job. Every day we delay comes at a cost that is shaping our future in real time. Another theme that came up again and again was our role as young people. For so long, we have been told that we are the future for health professions, or we are the future. But after everything we've heard and everything that we have discussed, I think that we can all agree tomorrow is too late. We are not just the next generation, we are the generation already making decisions, shaping the culture, influencing how medicines are used, how animals are being raised, how food is produced, and how our systems respond. So each one of us might feel like a single pixel right now, but together we form a picture strong enough to shift global culture. Education and training also emerged as powerful tools, not just to inform, but to also challenge the norm and behaviors that have become routine. Changing culture is more difficult than changing curricula, but it's also far more important. And alongside that, we spoke about innovation, new alternatives, new diagnostics, new approaches, and the possibilities of digitalization. We are no longer in a race against the machine. we have the opportunity to help the machine race for us. Technology, when used responsibly, of course, can accelerate stewardship and help us act smarter and faster than ever before. One of the most meaningful achievements of this summit is something we created together, the Global AMR Youth Summit Manifesto. Built on your voices, your experiences, and your ideas, this document reflects the priorities and expectations of young people across all fields. It represents our unity and our commitment, but it also sends a message to institutions and policymakers that young people are not just passive observers in this crisis. We are stakeholders, contributors, and we are ready to lead. So before I close, I would like to take a brief moment to invite you for a short reflection, not to break the flow, but just to recognize the power of what we have experienced together. So with this, I invite you to raise your hand if during this summit you learned something that changed your perspective on AMR. All right, look at the raised hands on the screen in front of you. This is what shared learning looks like. Next up, I would like to ask, raise your hand if you had made at least one connection here that you want to continue after the summit. Look at all those hands. This is what cross-sector collaboration looks like. And finally, raise your hand if you are willing, not someday, not in a distant future, but starting now to be part of the solution. Amazing. This is what movement looks like. As you lower your hands, I ask you to carry this momentum with you. Everything we've built here, the knowledge, the connections, the manifesto, the spark, it cannot stay within these virtual walls. Let it travel with you to your universities, your workplaces, your communities, and your networks. Let it influence your decisions, your conversations, and your ambitions. On behalf of the World Health Student Alliance, we thank you for your passion, your openness, and your commitment over these 3 days. Together, across all our fields, we will preserve the medicines that safeguard life, and we will drive the change our systems urgently need. And lastly, we will help the world win the race against antimicrobial resistance. Thank you, everyone, for attending this 3-day summit. And before we are officially closing and sending the attendance list, we would love for all of you to open up your camera so we can make some final pictures with all of us together, and so you can showcase your commitment to fighting against antimicrobial resistance. All right, thank you so much, everyone, for turning on your camera. I will require some assistance with taking all the pictures because there's so many of you here. It's very lovely to have you with us. So keep on smiling and we will try to capture all of you in multiple screens. Thank you. All right, just a few more. There are a lot of pages. All right, I think pictures have been taken, but do not shut off your cameras. It's really lovely to see all of you here. So yeah, to summarize the summit, I do hope that you all feel motivated to spread awareness and to not just keep all that you have learned within those, so to say, virtual walls, that you go out there, share your new knowledge with your communities, your networks, and stay engaged in the fight against the antimicrobial resistance. So regarding the attendance and certificates, because I've noticed there's a lot of questions already in the chat, the link will be shared with you soon. And those participants that attended at least 80% of all of the sessions will be eligible for certificates. We do ask for a little bit of patience when it comes to certificates because we will be preparing them, but you can rest assured that they will be received in your inbox rather soon. And if you have any questions, feel free to reach out to us. We're more than happy to help you answer. And yeah, once again, on behalf of the World Health Student Alliance, we thank you for bearing with us during this 3-day summit, and we hope to see you next year again. Thank you. So feel free to drop any of thoughts or after thoughts that you have in the chat. We'd love to read them. And also don't forget to leave some feedback in the attendance form. Thank you.
If anyone wants to share their experience, feel free to raise your hand or type in the chat. While you're filling in, of course, the attendance form, please don't forget, it is very important. So if there's anything you would like to share about your experience during this event, feel free to raise your hand and share it with us, or you can share it in the chat. Bir, yes. You can't unmute. No, I asked you to unmute. Yes, okay.
Hi, can you hear me?
Yes.
So I am so happy. As I previously said, it was a journey. This whole summit was a journey, and I'm so excited to complete and finish the journey with the on-setting and the on-site events, conferences, work that I'll be leading in my local city. It was such a pleasure to meet inspiring panelists, organizers, moderators, and participants. The whole summit, the whole event was quite amazing. I really can't find the words, the proper words to describe it well. And as I previously said, cheers to more collaboration in the days, years to come, so that we can tackle this issue or help tackle it at least. And that's it. So happy to collaborate with you guys in the coming time. And thank you so much. Have a great rest of your day. Thank you.
Thank you so much. We have also Saima. I think you also can't unmute, so I will ask you to unmute. Here you go.
Thank you so much. Can you hear me?
Yes.
Okay, perfect. Hi everyone, and special highs to Anna. This opportunity was brought to me by an email in the server, and I was like, okay, this is very interesting. Now, I'm not a girl who would usually go to something that I would genuinely study, but I was like, okay, there is a youth summit. There is lots of professions here, lots of associations. So I want to see the creativity that will be brought up to the table. I'm the type of person who gets genuinely amazed by young people who do creative things. And this sixth edition, for me, it was the first time to see something like this. So honestly, a special thanks to you organizers and moderators, because it's never easy, especially for us as a youth. We're different than adults in one thing. We study, we have our own hobbies, and then we come and try to change the world. So this is not easy. So for you guys to come here and be so inspiring, it's amazing. To be honest, genuinely, we are amazed. And from my side, I personally believe that I am so inspired. I'm someone who was displaced for 2 years due to the war in my country. However, today, I just can say proudly that I have learned concepts that I would just genuinely read during my studies. And now I look at them from a very different perspective. And that's thanks to you. So I think one key message would be that we as youth should continue on the journey of not only advocating, but capacitating other youth. Because from what I've gotten so far, I was inspired by youth. And now I'm inspired to literally inspire other youth. So thank you for that. Thank you for this amazing Global AMR Youth Summit. You have done excellent. And yeah, that's basically it.
Thank you so much. It was great to have you here. I think Bara had their hand raised, but I see also Sangabalu. Let me ask you to unmute. Go ahead.
Hi.
Hi.
Can you audible?
Yes.
Yeah, I am Tangabalu from India. Actually, before attending this session, I thought that AMR is completely related to only antibiotics and their use. So many AMR awareness programs are conducted in our college too, but on the time, I really don't know how these much are collaborated. I mean, how these much interconnections will be there, particularly when I came to know that one of the concept. I before that even didn't know that it's like one of the concept is there in AMR. But now I came to know how the human health and animal health and how the environmental health are interconnected, and how we want to save all these, and how we want to protect, and thereby we can reduce the AMR. And it is the first session, I think so, in after joining in IFMSA, and really I will be amazed and inspired, and I didn't know how to express my feeling. And thank you to all one and one professors and those who taken the amazing and inspired lectures and coordinators and speakers. And thank you so much.
Thank you so much. I see also Madhura. We can't hear you. Can you try to unmute? Yes.
Yeah, I'm audible now?
Yes.
Yeah, thank you. So actually, yesterday, as I mentioned in my opinion, from day's view, from seeing the reports of one of my patient having the resistance to all of the antibiotics. So from seeing there to I introduced this conference, and then I joined for learning the concept. What should we do? And I thought really it was just let's give a try. But I think like hands down to every session, because learning concept and then applying this in real world is really easy by means of this global conference. And I hope so. I will look forward to join again in the next session, and great time with all of you. Thank you.
Thank you so much. You have Zainab.
Hello. Yeah, can you hear me?
Yes.
Yeah, thank you. So it was an amazing sessions for these 3 days. It was super interactive, and I found answer to all my questions. So thank you so much for this amazing organization. So I had a question. I couldn't fill the first day's attendance link because I had the internet problem at the end. So would it be problem? So if it's not a problem, could you check the Zoom attendance? Is it okay?
You can email us if you have a problem with the form. You can email us to see it separately. And thank you for letting us know and for sharing your reflections. Also, Safiki has his hand raised.
Yeah.
We can hear you.
Can you hear me? Yeah. Thank you and all of you and the participants, the speakers, and all the global and AMR youth meet participants. Thank you for this wonderful summit. I hope we all got benefited for this wonderful summit. Um, I wanted to add one point, and that is we all are youth, um, and we need to collaborate. We are from many sectors such as veterinary. I am a doctor of veterinary student. I'm a doctor of veterinary medicine, veterinary sector, medical sector, dentist, pharmaceutical. All of us, we have to collaborate to change AMR awareness for our society, to raise awareness for our society. So to make this raising awareness, um, every student of us needs opportunities to increase his own um, skills in his field, specifically scholarship opportunities around the world. So every student in this summit needs to increase um, uh, his own knowledge. So at that time, he can raise awareness and he can progress anything about AMR in his country or the whole society. So I would like to share any opportunity of the world, specifically every one of us and he's from country. So he knows some opportunities in this country. So we have to share those opportunities. Also, we need to make platforms those we can meet anytime. And specifically, um, we are from different associations, such as IFISA and medical associations, statistical associations, agriculture, something like that. So we are sectors. So, but as I think we don't have all association that we can meet all of us. So at that time we cannot get chances. We can meet all of us. So I would like um, to do that association is, and if it exists, you can share with me. Maybe I don't get that. So that is my point. I would like to add this. we need to share opportunities around the world to make antimicrobial resistance eradicated. Thank you so much. Thank you so much.
Thank you so much for sharing your reflections. We also have someone else from South Sudan.
All right. All right. Thank you so much, the moderator and the participants of this great summit. My name is Daniel Bith from the Federation of South Sudan Medical Students Association. So my take from this wonderful summit is that I actually have learned so much about the antimicrobial resistance, just like a colleague from India the other time spoke about, because throughout, majority of the students just have the perspective that antimicrobial resistance is something to do with antibiotics specifically. That has been the perception. And I think it's a great contributor to the search in the antimicrobial resistance. So more importantly, I actually have just understood that as a youth, I actually have a big role to play, not just as a bystander. I have a big role to play in AMR. So that role can be effectively achieved if I consider working with other disciplines. So, and that's why I should say I'm thankful to the organizing committee and the World Health Students Association as a whole. So I think there are many people who would also want to say something. Thank you. Thank you. Thank you.
Thank you so much. Ala?
Can you hear me?
Yes.
Yeah. Hello, everyone. Good evening. To get into the point, honestly, I came here a bit overwhelmed. AMR felt like a huge invisible enemy. How are we supposed to fight something we can't even see? But this summit changed that. You, the organizers, the speakers, didn't just give us data. You give us a voice. You showed us that our energy and our voices are the most powerful weapons against superbugs. We are not just the future, we are the now. We are the ones who will call out antibiotic misuse, spread the word on social media, and demand action from our leaders. So, from the bottom of my heart, thank you for believing in us. Let's go. Let's go cause some necessary trouble. The resistance starts with us. Let's go. Thank you.
Thank you so much for your inspiring message. We have also the Boo Jacob.
Hello, everyone.
Hi.
Can I be heard? Yeah. So my name is Debu Jacob, and I'm a medical student from Ghana. I must say that I learned a lot coming to the summit. I had my own perceptions and knowledge about antimicrobial resistance, but with what I've been exposed to and what I've been taught here, I've taken cues of so many things that I even least expected as a medical student I could do. In the presentation, they made mention of the fact that medical students, and my country inclusive, we are not being made to prescribe. It's not part of the things that we are supposed to do as medical students, but we learning right from here what we can do as medical students, even on social media, in advocacy and education that we do. It will go a very long way to help and prevent most of the things that are being practiced within the communities that contribute to antimicrobial resistance. So this is a top-notch summit, and I've learned a lot. And I say a very big thank you to the organizers and all the facilitators and the speakers who came to mentor us. Thank you so much. We really appreciate this.
Thank you so much for your kind words. We have someone with the name Exemplary.
Yeah, good evening. My name is Lalike Philip from Nigeria. So thank you so much for this summit. It's really enlightening. So I learned a lot, even as a pharmacy student. So and I learned about the antimicrobial resistance and in a way where we can come in as a professionals. And I learned about how we can start from even our families by enlightening them about drugs, the advantages of taking drugs without prescription or taking more than prescription. So especially antibiotics drugs. So I learned a lot. Thank you so much for this program. So thank you. And I want to ask a question if I can be able to join the International Pharmaceutical Students Federation. So I want to join the groups, ma. All right, ma. Thank you.
Thank you so much. You can, someone from IPSF can contact you or put something in the chat, but in general, feel free to contact the people that we have here from IPSF. We have Tasavur, we have Eleanor, we have Whitney. Please, you can reach out to their email to see how you can engage in your national organization of IPSF. I think we have to raise hands. Is it new hands? Because I think you both went. It's new hands. Let's take some people that can go yet. And we will get back to you, Hamzat.
Good evening, everyone. Am I audible enough?
Yes.
I am by name Abdulmuiz Aidili Hamzat, a fourth-year medical student from Federal University of Health Sciences, Azare, Nigeria. So I want to, in a special way, thank the organizer of this awesome summit. As a fourth-year medical student, coincidentally, I'm currently taking a branch of bacteriology, microbiology that deals with antimicrobial therapy. So this summit has been like kind of very productive for me in particular. It has widened my scope about AMR, and I'm confident that other people would have actually have similar experience. In my own little way, I'm going to like take up the advocacy role and spread the gospel of AMR to my family, my colleagues, and my community in general. Thank you very much.
Thank you so much. We have Marup Khan.
Thank you. Am I audible?
Yes, we can hear you.
Hello. Good evening. I am Mohammad Abdul Maruf from Bangladesh. I am a veterinary medicine student. I also wrote about a sound bullet like AMR. Everyone sounds about AMR through repeated sentence. Finally, I get a bunch of motivation from these interactive sessions to give a deep dive with a new motivation about youth roles in AMR. Thanks to all of organizations for such efforts and interactive sessions. Thank you.
Thank you so much for your kind words. And we have also Abika Bowe. I think I pronounced it almost correct. Can we get the links to the profiles of presenters and moderators? Yes, you can get the links of the profiles of presenters, but basically we have shared in our social media already their names and affiliations. So I think it will be very easy and quicker, maybe instead of waiting for us to share it to search it. Anyone else that Okay, we're gonna take one last person because I think the hands are multiplying. Abraham, you have the floor.
Thank you, Anna. So, and everyone who's here, I'm really grateful for this opportunity to come and attend a youth summit about antibiotics resistance, antimicrobial resistance. So, actually, before I attended this, I had a little knowledge about resistance of the microbes. So, as our friend said before, we usually thought maybe it's something concerning with humans only, but now it has a wide variety of animal considered there and boats and all this. So even us, we used to be the victim of all this before. We used to, as a medical student, sometimes you self-medicated yourself. You can go and prescribe yourself some medication, all this. Now we really have a vast knowledge about it, and we should exercise the knowledge that we have here to help our friends, to help our families, and also if there is a chance to get a space to be fully engaged in all these things, that will be real very good. And thank you so much, Anna, and thanks everyone who attended. We all benefit from each other's knowledge. Thank you.
Thank you so much. And I think with these words, we can wrap up the meeting. So please, one last reminder to scan the QR code or click on the link for the attendance for today. If you have any further questions, please email us, but don't reply to everyone in the emails that we have sent because this includes all the participants of the session. That's a lot of people that you're gonna be emailing, so you don't want this. But thank you so much for being here these past 3 days and for being participants in this summit. We remind you also that we will be having another activity on AMR during January. So please keep your eyes open for this. We're gonna share it in our social media. And if you have anything else you would like to share, please you can share also in the WhatsApp group that we have created for all of the participants. You can share your reflections there. It was great to have you here. And it was great for another year as the World Healthcare Student Alliance to be here and do this event to capacitate people and raise awareness on AMR. Thank you so much for being part of this because, of course, without any participants, we don't have any impact. And thank you also for helping us out with the manifesto. Your inputs were essential. And we hope to get some rest now after all these days in front of the computer. Enjoy your time and keep advocating for AMR.